What if I told you that one of the most powerful ideas about your health didn't come from some new wonder drug or a fancy diet, but from a concept that the World Health Organization came up with way back in 1984? It's true. So today, let's dig into this game-changing idea and see how it completely flipped the script on what it means to be well. First, let me ask you something. When you think about being healthy, what comes to mind? Is it just not being sick? For a really, really long time, that was pretty much the standard answer. If you didn't have a cold or some diagnosed disease, hey, you were considered healthy. But what if that's missing the whole point?
See, for ages, the way we looked at health was totally reactive. You basically wait for something to go wrong and then you try to fix it. But in 1984, the WHO took that idea and turned it completely on its head. They said, hold on, health isn't the goal, it's a resource. Think of it like fuel in your tank. It's what you need to live a full, meaningful life. So, here's our game plan for this explainer. First, we'll talk about what this positive concept of health really is. Then, we'll get to the official name for it and the 5 key principles behind it. After that, we'll see why creating health is really a team sport, and finally, we'll connect it all back to why this idea from 40 years ago is more important than ever.
Okay, let's dive into part 1. This is where we see the first big shift in thinking. Health is way more than just not having a disease. It's about moving beyond the doctor's office and into the real world, into our everyday lives. And this quote right here from that original 1984 document is the absolute core of it all. Health is a resource for everyday life, not the objective of living. I mean, that changes everything, doesn't it? Health isn't the finish line, it's what allows you to run the race of life. And it's not just about your body, it's also about having friends you can count on and that inner strength to handle whatever life throws at you.
Now, an idea of this revolutionary needs a name, right? It needs a framework. And that brings us right to our second section, where we get the official terminology.
And here it is. The term is health promotion. The WHO defines it as the process of enabling people to increase control over and to improve their health. Now that word enabling is so important. It's the magic word. This isn't about doctors telling you what to do. It's about creating the conditions that empower people to take charge of their own well-being.
Okay, a definition is a great start. But how do you actually do health promotion? How do you make it real? Well, that leads us straight into section 3, the 5 core principles. You can think of this as the blueprint for action. So the WHO laid out this fantastic 5-point plan. First, you have to involve everybody, not just the people who are already sick. Second, you've got to look at the root causes of what makes us healthy or unhealthy in the first place. Third, you use a whole toolbox of different strategies. Fourth, you get the public involved, really involved. And fifth, you completely rethink what hospitals and clinics are for. Let's break each of those down.
So, principle number 1. This is about shifting our focus from just the high-risk groups to everyone. It's about creating an entire environment in our communities, in our schools, where the healthy choice is the easy choice for every single person. All right, principle 2 gets right to the heart of it. It's about tackling the determinants of health. Now that's a fancy term, but it just means the conditions in which we're born, we grow, we live, and we work. We're talking about things like having a safe place to live, a good education, a steady income. This is why you can't build a healthy society from just inside a hospital. You need everyone, from city planners to teachers, on board.
Principle 3 is all about using every tool in the shed. Health promotion isn't a one-trick pony. It uses everything from TV ads and classroom lessons to big-picture stuff like laws. Think about seatbelt laws or making public spaces smoke-free, all the way to grassroots community organizing. It's a full-court press.
Number 4 is all about empowerment. It's about effective and concrete public participation. So instead of experts coming in and telling a community what it needs, this principle says, let's empower the community to figure out its own problems and be a real partner in finding the solutions. It's basically health by the people, for the people.
And the 5th and final principle, this one reimagines the role of healthcare itself. The job of doctors and nurses shifts from being the sole providers of health to being partners, facilitators, enablers. Their new role is to help communities build their own ability to be healthy. Okay, so if the role of doctors is changing, that really begs a bigger question, doesn't it? And that brings us right to section 4. Health is a team sport. So who exactly is on this team? If the responsibility for health isn't just on the healthcare system anymore, then whose job is it? Well, the answer is it's everybody, all of us. Health is something we create together. It starts with us, in our families. It's nurtured in our communities.
It's supported by health professionals and our governments. But, and this is the big one, it's also shaped by every other part of society, from the people who design our cities to the companies we work for.
So let's bring all this home with our last section. Your health, our world. Why on earth does this idea from the 80s feel so incredibly urgent right now?
It's because of this. This one sentence from that document just says it all, doesn't it? Health is created and lived by people within the settings of their everyday life, where they learn, work, play, and love. Health isn't something you pick up from a pharmacy. It's built in our homes, our schools, our jobs, our neighborhoods. It's woven into the fabric of our lives. So I'll leave you with a final thought, a little bit of homework. Take a look around your own community. What's one thing, a park, a community center, a local policy, that actively builds health as a resource? And what's one thing that could be better? Because the real power of this idea from 1984 is that it gives every single one of us a role to play. Thanks for exploring this with me.